Hello everyone, welcome to Pediatrics by Dr. Anand. If my voice is audible to everyone, please put a message in the comment section. Thank you so much. Hello everyone, कैसे हैं आप सब लोग? What's happening? My name is Dr. Anand and today we're gonna talk about what? What are we gonna talk about? We're gonna talk about a very nice topic that is most importantly PGI Chandigarh recall questions. I need to confirm whether my voice is audible to everyone. Please put a message in the comment section. Thank you. Is my voice coming or is my voice not coming? Yes, I think I can hear my voice. Yes, great. Let's start the beautiful session. Hello, everyone. Yes, this is the PGI Chandigarh Part 3 questions. And yes, my name is Dr. Anand. I'm assistant professor in a college. And most importantly, point number one in Unacademy. First of all, we have this beautiful NEET PG test calendar. As this is March, as we have the week 2, basically, we have this beautiful, mind-blowing, what you call class, this NEET PG sessions we have basically, where we have this free test. Can we see that? 11th March, 10th March, 9th March, on my birthday also see there is a class. Okay, so sweet, so nice. That's what. So this is the main amazing class. I want everyone to participate in these classes. Also at the same time in Unacademy we have something known as plus subscription, where we get all the access to the live and recorded classes. We get to study from the best of the best educators all over the India, and we get to watch me. You can watch me on your iOS, Android, laptop, anywhere. And also we have something known as iconic subscription, where we get the Unacademy platform and the prep ladder subscription, all the clinical notes, recorded lectures, syllabus, rapid revision, live classes, everything on the iconic subscription. And congratulations to amazing FMG topper students who are working so hard, and they are the toppers. We have a new batch who is working very hard, and I want your names also to be there in this one. Also in Unacademy, if you are a newcomer, then please download Unacademy app, where most importantly we have something known as special class, which is one of the highlighter of Unacademy. In special classes we can put a lot of MCQs poll, and you can participate and earn good money and nice points also in these special and live classes. So it's a special class features. You never miss the classes because all the lectures are recorded. And boost your medical PG prep. If you take a 3 months plan, you get 1 month complimentary, and accordingly like that. All you have to use the code. Being a MBBS student, sometimes it's difficult to buy an expensive pack. So this code, Dr. Anand, is this amazing code which if you use, you get some good discount. Also, we have a Mission INICT, as everyone knows. We have this Mission INICT 2022 batch, 2 months ke liye. It is very good. Also, the other batches we have, one of my favorite is High Yield MCQ Marathon batch. High Yield MCQs Marathon batch, which I am a part of it, and which is very nice. It'll be helpful for you. And for FMG students, we have a 2 months FMG batch, and last batch we have is the revision batch. If you have studied everything, then you should participate in this revision batch, where you have the revision classes. Then we have a self-study time you will get. Then I'll take a test, and then most importantly, solution discussion. We will have a solution discussion. That's it. So I told you about the plus classes, about the iconic subscription, and about the plans and the months and everything. Okay, let's start the beautiful journey. Let's start this amazing mind-blowing session of the PGI Chandigarh, basically part 3 questions, which are one of the top highlighters of the classes. So before starting any amazing segment, we always have a beautiful quote, and today's beautiful quote is, nobody is too busy. Nobody is too busy. It's just a matter of priorities. Nobody is busy in life. It is just a matter of priorities. If you get an unknown call, suddenly we'll pick up the unknown call saying, "Kya who is calling me at this point of time?" And if some of cousins call, any of our relatives call, then we'll say, "No, we are very busy. No, time ही नहीं है. We are very busy. Time नहीं है मेरे पास. I'm very busy, right?" So no one is too busy. It's all about priorities. Hello, hi Ganja. Yes, buddy. What's up, Ganja? How are you, brother? How is everything going? Very good. Ganja is one of our best of the best students who is working really hard to get into the rank. And yes, Ganja nailed it. Ganja always answers very nicely. Very good, bro. I'm really happy to look at you. Also, let's start. Yeah. Now this questions, like this PGI questions, remember guys, number one, multiple options are correct, and number two, it's little tough, like little level good quality questions, I would say they have it. Okay. So let's start. So Ganja, what do you think? Please read the question. Which of the following are found in neonatal lupus? Neonatal lupus. Very important question. So which of the following are found in neonatal lupus? The option are anti-dsDNA, anti-histone bodies, anti-La, anti-Rho, and anti-U1RNP antibodies. So what do you think? Hriday, very good. See, Hriday is answering so beautifully. So, which of the following founding neonatal lupus? Neonatal lupus. Not SLE, I'm asking neonatal lupus. So, what do you think, Hriday, buddy? Very good. Hriday is answering so good. Yes, most importantly, okay, what happens in neonatal lupus? If I am a newcomer right now, मुझे नहीं पता कि what happens in neonatal lupus. The point number one, photographic memory. Photographic memory is everything in life. Very good, Hriday. Very good, Ganja. Photographic memory is everything in life. So look at the picture and tell the diagnosis. Look at the picture and tell the diagnosis. So this is a neonatal lupus. NLE, neonatal lupus erythematosus, right? What are the, sir, for PG exam, please tell me what are the important points for neonatal lupus erythematosus. Point number one, yes, of course, it is seen in those whose mother have auto antibodies against. It is seen in neonatal lupus erythematosus is seen in those whose mother have auto antibodies against the anti-Rho, an anti-La, and RNP. What is RNP? Ribonuclear protein. I'll repeat again. This neonatal lupus erythematosus, it is seen in those whose mother have antibodies against the Rho SSA, La SSB, and RNP. RNP is ribonuclear protein. Okay. Also, which is the most common congenital heart defect? Who will tell me? Apna Hriday, which is the most common congenital heart defect in a case of neonatal lupus erythematosus? What do you think? Anyone? Yes, very good, very good. So the is nothing but complete heart block. Beautiful. The most common congenital heart defect, if we talk about in a case of neonatal lupus erythematosus, is congenital complete heart block. And also, yes, a very important picture of neonatal lupus. Even this picture also is very, very important. It could be a image based question for the NEET PG and for Nieman's paper, so that you should know. That's it. So the best answer is anti-La, anti-Rho, and anti-U1 ribonucleotide protein. So anti-La antibodies you will see anti-Rho also, and anti-U1 RNP. Very good, perfect. Hi Neeraj, very good, brother. So yes. So most importantly, let's see the next question. Next question I think is very easy. Which of the following surgeries are used for tetralogy of Phallic? One of the very simple and basic question. Let's finish this class as amazing as possible. Which of the following surgeries are used for tetralogy of Phallic? Anyone? Hriday, what do you think, bro? The options are modified Blalock-Taussig shunt. What are the other options? The options we have is Watterson-Cooley shunt, and other options we have is very nice. This one, Port shunt. I think everyone knows about it. What do you think, Ganja? Yes, very good, very good. So I think everyone knows about tetralogy of Phallic. Yes, very good. So three things are there. See, what are the components of tetralogy of Phallic? So this is my four-chambered heart, right? This is my four-chambered heart. Tetralogy of Phallic. The components are tetra means four components are there. Number one, sorry. Number one, right ventricular hypertrophy. Yes, am I right here? Very good. Number two, what do you have? Number two, you have the pulmonary stenosis. Yes. Then we have the ventricular septal defect, and then we have the overriding of aorta, right? Overriding of aorta. Very good. So these are the four components we have, right? Perfect. Perfect, Savan. Very good, Julie. So my question is, which of the following surgeries are used for tetralogy of Phallic? So what happens? See, there is pulmonary stenosis. So pulmonary stenosis is there. No. So what will happen? I will connect. What is this? This is pulmonary artery, right? I will connect my pulmonary artery to somewhere else. I will connect my pulmonary artery to somewhere else. Either I will connect my pulmonary artery to the subclavian artery, or I will connect my pulmonary artery to the arch of aorta, or I will connect my pulmonary artery to the descending aorta. Why, sir? Why are you connecting my pulmonary artery to everywhere? Pulmonary stenosis is there, no? Pulmonary valve is blocked. Pulmonary artery, आगे से it is blocked. So pulmonary artery, number one, this is the pulmonary artery. So if I connect my pulmonary artery to the subclavian artery, this is known as Blalock-Taussig shunt. Blalock-Taussig shunt. If I connect, what happens in Blalock-Taussig shunt? Please remember, okay, Neeraj, Julie, very good. If I connect my pulmonary artery with the subclavian artery, that is Blalock-Taussig shunt. If I connect my pulmonary artery into the what do you call ascending aorta, then that is water. If you're giving a water, imagine you are giving water. You are giving water. Whom are you giving water? You're giving water to a pot. You're giving water to a pot. If you're giving water means nothing but that is ascending. That is yeah, exactly. If you connect, yes, that's right. Yes, very good. If you connect my pulmonary artery to the subclavian artery, that is nothing but Blalock-Taussig shunt. If you connect my pulmonary artery to the ascending aorta, or I would say the arch of aorta, then it is Watterson shunt, mainly ascending aorta. And if you connect my pulmonary artery to the descending aorta, then that is Potts shunt. That is Potts shunt. Yes, nowadays we have Geratox shunt also. Yes, exactly. Then we have Glenn shunt also. We have modified Blalock-Taussig shunt also. Yes, exactly. If you connect my pulmonary artery to the superior vena cava, if you connect my pulmonary artery to the superior vena cava, and that is known as Glenn shunt. That is known as Glenn shunt. Very good. Very beautiful. People are answering. Very nice. So that's what. And where do you see boot-shaped heart? Boot-shaped heart is it is seen in Tetralogy of Phallic. Everyone knows about it. Yes, Tetralogy of Phallic, number one. And most importantly, the boot shape basically is because of RVH. The boot shape is because of right ventricular hypertrophy. Remember that, right ventricular hypertrophy. Done. Very good. So that's why the following surgeries which are used for Tetralogy of Phallic are nothing but Blalock-Taussig shunt, Watterson shunt. The full name is Watterson-Cooley shunt, and then we have Potts shunt. Potts shunt. Okay, hi Savan, what's up? So Savan is amazing. Savan, just now me and Savan, Savan is one of my juniors. We have met him, and what he has got me on my birthday. Thank you, Savan, for this amazing toffees and chocolates. Thank you, bro. God bless you. And my family was so happy that you came and you were there. Thank you so much. Very nice, very nice. Okay, next question. What is the next question? Next question is very easy. So yes, what is the next question? Anyone? That's nice. So Julie, what do you think? What is this? Can anyone tell me the highlighter? What is this? Anyone? Yes, very good. Yes, exactly. Julie says share with me also. Chocolates and sharing. It's very tough. I'm kidding. We'll share. We'll have together. Yes, exactly. ठीक है. हृदय कह रहा है सावन मेरे से भी फ्रेंडशिप कर लो. Very sweet. Savan is a gem. He's one of the best juniors we ever have. So yes, what do you think exactly? This is nothing but lanugo. This is nothing but lanugo, right? What is lanugo? Abundant hair at the shoulder and the back. Abundant hair at the shoulder and the back is nothing but lanugo. So PG entrance question number one: do you see lanugo in preterms, or do you see lanugo in terms, or do you see lanugo in both preterms and terms? What do you think? Anyone? Yes, exactly. So where do you see the lanugo? Do you see in preterms? Do you see in terms, or do you see in both preterms and terms? The best answer is you see only and only in preterms. Lanugo is abundant hair in the preterms. Term babies don't have lanugo. Term babies don't have hair at the shoulder and the back. They just have scalp hairs which are smooth, silky and shiny. So the PGI question, the PGI Chandigarh question was lanugo hair occurs in multiple options are correct. Can anyone tell me multiple options are correct? Yes, exactly. What do you think? Very good. What multiple options are correct. So what do you think? Savan, Shubhangi, Hriday, Julie, Monimala Naskar. Yes, very good. Shubhangi says, Julie, I made something. यहाँ बता दूंगी तो surprise नहीं रहेगा. Oh, मुझे पता, मैंने पढ़ लिया. Osama also is sending something. That's very sweet of you. So Lanugo. What do you think? What are the multiple options? Yes, exactly. Yes, very good. Neeraj Mishra is right. Lanugo, so most importantly, the best answer for this question is Lanugo, our hair occurs in preterm. Yes, they are hairs at the shoulder and the back. Yes, and they also can you see Lanugo in fetus also? Yes, a fetus baby basically can have Lanugo. So Lanugo hair occur in preterms, at shoulder, and in fetus also. So A, C, and E is the best answer. Do you see lanugo in the palms? No. Do you see lanugo in post-term babies? No. That's what you should know. Next question. Yeah. So now please remember, guys, this is little level questions, these are usually of IAP quiz and big quizzes questions these are. So try to answer as much as possible. Craniosynostosis. Craniosynostosis is seen in what all syndromes? And remember, multiple options are correct. Craniosynostosis. What is craniosynostosis? I forgot. Exactly. Craniosynostosis is nothing but premature fusion of the suture. Exactly. Premature fusion of the sutures basically. And how many sutures we have? We all know that we have multiple sutures, ladies and gentlemen. So yes, we have nothing but metopic suture. We have coronal suture. we have sagittal suture, and we have lambdoid suture. ठीक है, metopic, coronal, sagittal, lambdoid, that's what, right? Yes, exactly. ठीक है. जूली says यूक्रेन से कैसे भागा? बड़ी मुश्किल से भागा है मेरा भाई, सच में बहुत मुश्किल से आया है. Okay, very good. Yes, beautiful answer. Okay, let's see. Anji, very good. Neeraj, Ganja, Savan. Yes, exactly. Julie. So, what are the multiple answers correct? Do you see? Okay, let me ask you a question. A, D, E. Yes. Do you see craniosynostosis in Down syndrome? Yes or no? Do you see craniosynostosis in Down syndrome? Yes, sir. Do see that? And which suture is involved in the Down syndrome? Is it metopic? Is it coronal? Is it sagittal? Or is it lambdoid? Who want to say? So Savans dear, yes, Down syndrome में, yes, Down syndrome में C, D for Down syndrome, usually coronal suture. In Down syndrome, coronal suture is involved. This suture, craniosynostosis, is present in the case of Down syndrome. And anyone, coronal suture overlapping or coronal suture premature fusion causes which craniosynostosis? Who will tell me? Exactly. Julie is right. It causes brachycephaly. है ना? Brachycephaly. Do you remember this? Yes or no? Can anyone tell me metopic suture overlapping causes what? Metopic suture overlapping causes trigonocephaly. Coronal suture overlapping causes brachycephaly. Sagittal suture overlapping causes dolichocephaly, or also known as scaphocephaly. And last but not the least, lambdoid suture craniosynostosis causes plagiocephaly. Plagiocephaly. Yes, exactly. यस. तो हृदय कह रहा है पीजीआई में जितने ऑप्शन करेक्ट करें वही इंपॉर्टेंट होते हैं ना. एक काम हो जाए तो चलेगा ना. एक कम होता है तो चलेगा ना. ऐसा होता तो है ब्रो, लेकिन मार्क्स बहुत कटते हैं. द बेस्ट आंसर फॉर दिस क्वेश्चन, यू नो व्हाट इज द बेस्ट आंसर? द ऑप्शन 4. You see craniosynostosis in Cruzen syndrome. You see craniosynostosis in Carpenter syndrome. You see craniosynostosis in Pfeiffer syndrome, and you see in Down syndrome. चार सिंड्रोम में होता है. डाउन सिंड्रोम तो एवरीवन नोज दैट कोरोनल सूचर क्रेनियोसाइनोस्टिस इज देयर एंड दैट लीड्स टू ब्रैकीसेफेली. है ना? डू यू रिमेंबर दैट? एग्जैक्टली. फाइफर सिंड्रोम, आई विल गिव यू. ओके. Do you want this M&M peanut wala chocolate? In your dream also, I will not give you. Okay, so tell me now. I'll give you my hanky if you want. Hanky I can give you. I will not give chocolate. As simple as that. I'll give you my hanky if you can tell me Pfeiffer syndrome. Any shape of skull, anything which is important for my PG question. Yes, exactly. So, Pfeiffer syndrome, which type of skull or which type of shape of skull do you see in Pfeiffer syndrome? Hriday, मैं मान जाऊंगा bro, बता दे please. Savan, what do you think? Okay, I agree. So many of you are saying FGFR1 gene mutation. ठीक है, I agree with you. FGFR1 gene mutation is seen in Pfeiffer syndrome. Julie, I'll kill you. So yes, so tell me, shape of skull. It's an important question. Please, anyone, कोई Monimala, Julie, Neeraj. Okay, I'll give you a hint. Answer तो मैं तब भी नहीं बताने वाला, जो मर्जी करना है कर लो. I'll give you one hint. Yes, I'll give. This is the hint. I few days back I had gone to gym. There also we had a plant near to my gym, and I took a picture, selfie video. Hello everyone, welcome to Pediatrics by Dr. Anand. So today's question is, as you can see this leaf, basically, which shape or which entity, what comes to my mind if I see about this one? Anyone? What do you think? Anyone? Hriday, मुंह खोलो बेटा. ओ गंदे दांत है. Oh, caries, you have caries, chocolate. I can see that. Exactly. Yeah, clover leaf. Yes or no? This is known as clover leaf. Clover leaf shape of skull. Can we appreciate like this and like this? Number one. And can we appreciate something like this? Very, very, very important picture. Clover leaf shaped skull. Clover leaf shaped skull is seen in nothing but Pfeiffer syndrome. ये जवाब किसी ने नहीं दिया. हाँ, इमेज स्लाइड देखने के बाद सबको चक्कर आया. हाँ, मुझे याद है. हाँ, या मैंने पढ़ा था क्लोवर लीफ तो पढ़ा था, तो ये आंसर है. क्लोवर लीफ शेप स्कल, इट इज सीन इन फाइफर सिंड्रोम. याद रहेगा? यस और नो? अब भूलेंगे हम या नहीं भूलेंगे? भूल के दिखाओ, भूल के दिखाओ. यहाँ रखी है टॉफी. यहाँ क्या रखा है मैंने? चप्पल. उधर क्या रखा है? डंडा. क्या कौन आंसर करेगा ना? हु विल आंसर? रेज योर हैंड्स. नाइस, नाउ यू कैन आंसर, राइट? वेरी गुड, वेरी गुड. So clover leaf shaped skull, sir, it is seen in Pfeiffer syndrome. So means, can we appreciate craniosynostosis or premature fusion of suture? Yes or no? Open your brains. Naturally, no. There is premature fusion of the sutures. That is why I'm able to see this abnormal shape of skull. है ना? Very good. Next important question I have. देखो अब समझ में आ रहा है ना everyone dear? ठीक है. My question was craniosynostosis is seen in what? So Down syndrome you see craniosynostosis we have covered. Pfeiffer syndrome you see clover leaf shaped skull, very important PG entrance question we have covered. Cruzen syndrome. Cruzen syndrome. Okay, let me show you a picture. This one. Not this one. Exactly. अगर ये एग्जाम में क्वेश्चन आ गया माय डियर फ्रेंड्स, व्हाट यू गोना राइट? प्लीज पे अटेंशन. कैन वी हैव अ गुड वाइब्स? आई वांट गुड वाइब्स, गुड वाइब्स, गुड वाइब्स, गुड वाइब्स. वेरी गुड, आई हैव गुड वाइब्स नाउ. तो यस, सो दिस, पहले मैं ऐसा दिखता था, अब मैं ऐसा दिखता हूँ. मैंने एनीवन? सो पहले मैं ऐसा दिखता था और अब मैं ऐसा दिखता हूँ. सो इन विच ऑफ द सिंड्रोम्स you get cosmetic correction done? Anyone? Cosmetic. So again I'm telling you dear, every syndrome has a highlighter. Pura you don't have to learn from A to Z, only highlighters are important. So can we remember C, C and C? C, C and C. So what are you telling C, sir? C, number one, C is Cruzen syndrome. This is Cruzen syndrome. Another C is craniofacial malformations. Can we see the cranium is gone? And craniofacial. Facial means, can we see the face? Yes or no, dear? Very good. So craniofacial malformation. And ये बच्चा यहाँ थर्ड इमेज में क्या कर रहा है? Cosmetic correction. Cosmetic correction. So तीन चीजें याद रहेंगी. Yes or no, शुभांगी? अब याद रहेगा. Cruzen syndrome has craniofacial malformations and you get a cosmetic correction done. That's what you do in these cases. And very important question. ठीक है? जूली कह रही कौन है वहाँ? लड़कियों की बड़ी आदत होती है हर चीज़ नोटिस करने की. My wife, she's getting ready, like not ready right now. We are not going tomorrow. As day after tomorrow is my birthday. So tomorrow we are planning to go somewhere, a nice place, somewhere 1 night, 2 days. Could you suggest me where should I go? Should I go to Lonavala? You're there from Mumbai. Pune जाएं? Pune, Lonavala अच्छा रहेगा? Please tell me, let me know. Thank you. So yes, so this is nothing but CCC. Cruzen syndrome has craniofacial malformations and cosmetic correction is done in a case of Cruzen syndrome. That's all we should remember. ठीक है, याद रहेगा dear. अच्छा, Cruzen syndrome, I'll give you a chocolate. Now this is the tough part of the class. What is the inheritance pattern? Let's see if we can have a small quiz here. What is the inheritance pattern? Hriday says 11th March. Yes bro, परसों 11th है ना, कल हम जा रहे हैं कहीं. हाँ जी, exactly. Very good, very beautiful. Neeraj is answering. Autosomal dominant. Autosomal dominant inheritance is there in the Cruzen syndrome. Gene mutation. Anyone? What do you think the gene mutation? Gene mutation. Gene mutation. Anyone? Yes, exactly. FGFR. FGFR2. Very good. FGFR2 gene mutation is there. Very good. Next question. Craniosynostosis. Yeah. Now very important question, bro. In this Cruzen syndrome, which of the sutures ka craniosynostosis is there? Which suture is involved in a case of Cruzen syndrome? Any wild guesses? Anyone? Any random guesses? हृदय आंसर कर. आज तू आंसर कम कर रहा है. इधर रैंक भी अच्छी नहीं आई. मैं बता रहा हूँ तेरे को, तू सुधर जा, वरना बता, मैं सुन लेगा मेरे मुंह से तो. Exactly. So we have a metopic suture, coronal suture, sagittal suture, and lambdoid suture, right? Which suture is involved in a case of Cruzen syndrome? C for Cruzen, C for C for Cruzen, C for coronal suture. C for Cruzen, C for coronal suture is involved, and that's what. So coronal suture is involved in a case of Cruzen syndrome, and even Down syndrome also. Yes or no? Down syndrome baby will have brachycephaly. Down syndrome also coronal suture is involved, and Cruzen syndrome also coronal suture is involved. सर मुझे याद कैसे रहेगा? CC. ठीक है, again cafe coffee day. In Cruzen syndrome there is coronal suture involved, and Down syndrome also there is a coronal suture involved. Remember, याद रहेगा dear. This was the question. Next question. And what else can we appreciate in this slide? Most importantly, can we see this kind of a maxillary hypoplasia? Maxilla अंदर दबा हुआ. Can we see that? Maxillary hypoplasia and mandible बाहर उठा हुआ है. Mandibular prognathism. Prognathism मतलब बाहर उठा हुआ. ठीक है. So maxillary hypoplasia and mandibular prognathism. Number one. Number two, beak nose. Can we see that beaked nose? अगेन वेरी वेरी इंपॉर्टेंट, बीक्ड नोज। तो ये सब पता होना चाहिए। अच्छा, जूली से ताजमहल, आगरा, गोवा, इट्स ओके, विल गो टू लीला समवेयर फॉर वन डे, दैट्स मोर देन एनफ। दैट्स इट, दीज आर द इंपॉर्टेंट पॉइंट्स ऑफ दीज सिंड्रोम्स। एंड व्हाट इज दिस फाइंडिंग, एनीवन? व्हाट इज दिस फाइंडिंग? मेरे को मैं खुद ही देख लूँ, हाँ ठीक है, मुझे याद है। हाँ जी, एनीवन? द सावन क्या है ये बताओ जल्दी ब्रो। शुभांगी, unbarasam, unbarasan. Okay, exactly. So most importantly, can we see the fusion of the digits? Can we see something known as syndactyly? Yes, exactly. What is syndactyly? Abnormal fusion of the digits is known as syndactyly, right? Very good. Beautiful answer. Yes, and again, very important, Pfeiffer syndrome. ये याद रखना, dear. This syndrome is important. It can come. Did we see syndactyly? Yes. Can you see brachycephaly, kind of a short head? Definitely, I can see a brachycephaly and broad thumbs. These babies also have broad, B-R-O-D, broad thumb. I will give you सावन की चॉकलेट, वैसे नहीं, आई विल नॉट गिव यू। सावन दे दूं चॉकलेट किसी और को या खुद रखनी है, क्या करना है सावन? सावन विल डिसाइड। आई विल गिव यू दिस M&M का पीनट वाला चॉकलेट इफ यू कैन टेल मी ब्रॉड थम्स। ब्रॉड थम्स, डू वी सी ब्रॉड थम्स एंड इन एनी अदर कंडीशन? व्हाट डू यू थिंक? हाँ जी, नहीं ऋतिक रोशन के तो वो क्या कहते हैं, ऋतिक रोशन का तो वो है ना, पॉलीडेक्टाइल है। हाँ जी, ब्रॉड थम्स, एनीवन? कहीं और मिलता है ब्रॉड थम्स? एक ये ब्रॉड थम्स बहुत इंपॉर्टेंट है। एनीवन? Savan, Shubhangi, Monimala, and okay, extra edge of points. Broad thumbs and great toe deviated. Broad thumbs and great toe deviated. Where do you see? Exactly. Thank God. Shubhangi, you are amazing. Mind blowing. Shubhangi has told the right answer. Have you heard of Rubinstein-Tybee syndrome? Rubinstein-Tybee syndrome. Yes, Rubinstein-Tybee syndrome will have broad thumbs, great toe deviated. The baby will have atrial septal defect, microcephaly, and intellectual disability. Very good, Shubhangi. So impressed by you. Very good. So broad thumbs are there in Rubinstein-Tybee syndrome also. Next question. So that's what FGFR1, FGFR2, FGFR3. I think every one of us knows that FGFR3 gene mutation you see in achondroplasia, and FGFR2 in Cruzen syndrome, and Pfeiffer syndrome also you'll see FGFR1. What is the inheritance pattern of achondroplasia? अपना ओसामा एंड अपना हृदय, हृदय बताओ ब्रो, achondroplasia में what is the inheritance? Is it X-linked dominant, autosomal recessive? What is the one? Anyone? सावन कह रहे चॉकलेट नहीं देना। फाइन ब्रो, डन, हम खाएंगे। एग्जैक्टली, ऑटोसोमल डोमिनेंट, याद रहेगा नहीं रहेगा? रिमेंबर डियर, इवन क्रूजन सिंड्रोम ऑल्सो, प्लीज रिमेंबर, 2 questions 1 answer, FGFR2, FGFR3. So Cruzen syndrome also and achondroplasia also has autosomal dominant inheritance. Link करके पढ़ो डियर, लिंक करके पढ़ो। Every one of you, I want you guys to be the best doctors on this planet. I am improving the generation. I'm trying my best to have a meaning of my existence. So you should have your meaning of existence, like you should write somewhere meaning of existence. What is the reason of your existence? I read a lot of spiritual books. In they say you need to have a meaning of your existence. Just don't, they say no, don't exist, you should live, right? So what is the meaning of your existence? My meaning or my reason for my existence is I am good in teaching and I can share my knowledge, I can motivate very well. This is the reason I am surviving. The question is, why are you surviving? Think about it sometimes. That's it. Okay, if I show you this picture, anyone? Yes, exactly. Ganja says you're doing a great job, teacher. Thank you, bro. Thank you so much. I'm nothing without your support. Okay, if this question comes in exam, imagine today is the NEET PG question. The day has come, और ये आ गया exam में. The question is, identify the images and please tell us the best diagnosis. Identify the images and tell us the best diagnosis. What do you think, anyone? Yes, exactly. Yes, Hriday has told a very beautiful thing. There are two important days in your life. There are two important days in your life. The day you are born and the day you know why. So that's what why wala thing is very important. Exactly. So Hriday is right. This is number one. Can we see microganetia, small jaw? Number one, microganetia. If there's a microganetia, there will be glossoptosis. What is glossoptosis? Downward and retraction of the tongue. Downward displacement and retraction of the tongue, that is known as glossoptosis. So microganetia, with glossoptosis, right? With U-shaped cleft palate. Can we appreciate this, dear? Yes or no? दिख रहा है कि नहीं दिख रहा? V-shape and U-shaped cleft palate. And if I also say difficult bag and mask ventilation, very important. It was, sir, in this baby, it was very difficult to do a bag and mask. क्यों? Because of micrognathia, that bag and mask, right? Mask, that seal basically has not formed properly to give a bag and mask because of the micrognathia. So which is this syndrome? Kamal is very, very right. This is the case of Pierre Robin syndrome. This is the care of पियर रॉबिन्सन. याद आया कि नहीं आया डियर? हमने पढ़ा था ये, जूली पढ़ा, एक एक मोती की तरह हमने पॉइंट्स पढ़े हैं और आपको मोती की तरह याद होना चाहिए. ठीक है, वेरी गुड. सो सर, व्हाई आर वी डिस्कसिंग दिस पियर रॉबिन syndrome over here? Because the question was craniosynostosis is seen in what all syndrome? So yes, in Pierre Robin syndrome it is not seen. Cruzen syndrome, yes. Craniofacial abnormalities, and even Carpenter syndrome also. Carpenter syndrome, or you can also say Apert syndrome. Remember, C for Cruzen, C for craniofacial. Remember, in Cruzen syndrome, only cranio and facial problems are there. Whereas in Carpenter or Apert syndrome, there will be craniofacial plus whole body, abnormalities will be there. Whereas in Cruzen, it's only and only craniofacial. But in Carpenter or Apert, it is cranio plus facial plus other body abnormalities are there. That you should know. Okay, next question. So again, a beautiful quote. If you cannot do great things, do small things in great way. So study well, study small things in very great way. Next question, very easy. True about Wilms tumor. Again, we have this level of question, guys. See if you can answer. Okay, Hanji, Julie, Kamal, Savan, what do you think? Multiple options are correct. True about Wilms tumor. I took a 1 hour class. Yes or no? I took a 1 hour class on Wilms tumor. Can you tell me what is true about Wilms tumor? What do you think? Any random guesses? Yes, very good, very good. What do you think, Savan? तुक्का मारो, ABCD सुनो. Yes, exactly. अच्छा, जूली इज राइट. जूली कह रही कि मैं यू शेप उस दिन कह रही थी. हाँ जूली, मैं समझ गया, याद आ गया मुझे. What is true about Wilms tumor? Let's revise 5 important points on Wilms tumor. Yes, the best answer. Okay, Wilms tumor. Can anyone tell me which is the most common? Let's talk about Wilms tumor. I am a NEET PG student. मैंने Wilms tumor revise नहीं किया, मेरे को तो याद ही नहीं है क्या points थे. So yes, can we revise something about Wilms tumor? Number one, which is the most common? Which is the most common malignant tumor of the kidney? The answer is Wilms tumor. Most common. Open your brains. Open your brain. नींद आ रही है? Feeling sleepy? Okay, take a coffee. If again feeling sleepy, imagine. Do you want to fail? Do you want to wait for 6 more months just because you are feeling sleepy today? Yes or no? No, right? Take a bucket. Put your head inside the water and get up and start listening to the lectures like this. नींद नहीं आएगा. ठीक है? The most common malignant tumor of kidney is Wilms tumor. Number one, it is one of the solid intrarenal mass. Wilms tumor, right? Kidney, nephrectomy. याद है हमने पढ़ा था करके stage 1, stage 2, stage 3 and all that. So it is a solid intrarenal mass with a pseudocapsule. Next question. Under 5 years, like 80%, yeah, exactly. 80% babies have Wilms tumor which are under 5 years of age. Under 5 years of age, there are 80% chance a baby will have Wilms tumor. Next, yeah, this is a good one. What is the peak age? What is the peak age of diagnosis of Wilms tumor? Anyone? I'm saying in 80% cases जो है Wilms tumor के, they are seen in less than 5-year-old. अब less than 5 भी कितना? What is the peak age? 1 to 2, 2 to 4, 4 to 5? What do you think? So 2 to 4 years of age has the peak age of diagnosis of the Wilms tumor. Next, very important, yeah. How many cases? Very good, Savan. Very good, Ganja, Neeraj, Shubhangi. How many cases of Wilms tumor are bilateral? What do you think? Now, this is a good question. This was the PGI question. Anyone? How many percent of cases the Wilms tumor is bilateral? Both kidneys are involved. Exactly. Hriday is very right. Yes, 6%. Only and only 6% in cases you have Wilms tumor, which is bilateral. Star mark. PG question. PGI Chandigarh question. तो 6%, मतलब बहुत रेयर होता है विल्म्स ट्यूमर बायलैटरल होना. एंड हाउ द पेशेंट विल प्रेजेंट? Asymptomatic abdominal mass detected by parents or physician during a routine examination, right? And very important, yeah, 30% students comes with abdominal pain. 30% of students will come with abdominal pain. Let's revise. What are we studying? We are studying Wilms tumor. Wilms tumor, we understood, number one, it is the most common malignant tumor of what? Of your head? No, not brains. No, no, no. Eyes? No, no, no. Where? Kidney. Most common malignant tumor of kidney, number one, it's a renal mass, na intrarenal mass with pseudocapsule. Under 80% chances are there that if you're less than 5 year old, you will have Wilms tumor. But 2 to 4 is the best age, and very 6%, very less people have this bilateral involvement, and it's like a asymptomatic abdominal mass which comes with abdominal pain, right? And what do you think? It's a Wilms tumor, right? Renal tumor, right? Is it ballotable or not ballotable? Yes or no? Savan, what do you think? Julie, हृदय गांजा नीरज शुभांगी is any kidney ka tumor or even renal mass, renal, even kidney itself, are kidneys ballotable or are kidneys not ballotable? Anyone? Yes, kidneys are ballotable. They move with respiration. They are ballotable. Renal lump is ballotable, right? And do you see any eye finding? Do you see any eye finding in a case of Wilms tumor? Yes, the answer is aniridia. What is aniridia? Aniridia is absence of iris. What is iris? The colored part. ये वाला colored part. Absence of the colored part of the iris is known as aniridia. Yes, Neeraj is right. And क्या बोलते हैं? Do you see aniridia in Wilms tumor? हाँ जी sir, definitely we see aniridia in Wilms tumor. So the best, and yeah, so and also in Wilms tumor kidney issue, no, kidney problem, right? Kidney. So kidney, then you have ureter and bladder, and testes also are nearby. So the patient will have cryptorchidism. What is cryptorchidism? Not undescended testis is known as cryptorchidism. And hypospadias and epispadias. What is hypospadias? What is epispadias? In hypospadias, my urethral opening is below my glans penis. In epispadias, it is above the glans penis, and I will have gonadal dysgenesis. तो 100 बात की एक बात ये है, what are the true points about Wilms tumor? Is it associated with aniridia? Is this line true or is this line false? This is true. Mostly unilateral. Hanji sir, it is unilateral because only 6% of cases it is bilateral. Is it surrounded by a pseudo capsule? Hanji sir, yes, it is surrounded by a pseudo capsule. It is most commonly present in neonates. No sir, no. किसमें present होता है anyone? Yeah, it is present in roughly less than 5 years of age, and the peak age is 2 to 4 years. 2 to 4 years is the peak age. And is it associated with a palpable abdominal mass? Yes sir, it is associated with palpable ballotable abdominal mass noticed by parents or noticed by physician as a routine examination, right? Has everyone understood this much? Yes, or yes, yes. What do you think? Very good. 10 more minutes, then this class is over. Very good. Next question. Yeah, this is a very classy question again. These questions are very next level. Like if someone who has read very nicely can only answer such questions. Very good questions these are. So difficult airway in a child. Difficult airway in a child is associated with what? Now, what do you think? Exactly. And remember, multiple options are correct. Savan, dear, multiple options are correct. Okay. So yes, let's have a quick review. Difficult airway is seen in which child? Number one, do you see difficult airway in Pierre-Robin syndrome? Yes or no? Just now we read about Pierre-Robin syndrome, right? What was the point? Microgenetia? Yes or no? Did I tell you microgenetia? Micro, chota, small jaw, right? And did I tell you glossoptosis? Downward displacement and retraction of tongue. And did I tell you difficult bag and mass ventilation? So can I say that do you see difficult airway in Pierre Robin? Yes, definitely, no doubt about it. Next, Turner syndrome. Do you know that Turner syndrome, one of the complications is cystic hygroma? Do you know that one of the complications, or as a true statement, can Turner syndrome babies can have cystic hygroma? Yes, definitely they can have cystic hygroma, like a bull neck kind of a thing. So they will have difficult airway. Choanal atresia. Choanal atresia. What happens in choanal atresia? Anyone? What happens in choanal atresia? So yes, you all know that difficult to pass a nasogastric tube and very easy to pass a orogastric tube, right? So if you're not able to pass a nasogastric tube in my nose, so will I have a difficult airway? Definitely yes. No, you will have a difficult airway. कोई doubt ही नहीं है इसके अंदर. Has everyone understood this much? Please say yes or put a like button to the video. समझ में आ रहा है ना मैं क्या बोल रहा हूँ? These are very prime questions, bro. You must understand. If you're not understanding, tell me. I will repeat again. But ये बहुत important है. ठीक है, done. Next one. Now two options are left: Fragile X syndrome and Dijorge syndrome. So remember, in Fragile X syndrome also and Dijorge syndrome also, you see difficult airway. So the best answer for this question is PGI Chandigarh Mahan answers. All are correct. All are correct. It's funny, right? So all are correct. Fragile X syndrome. Let's talk about Fragile X syndrome. I am a NEET PG student. I don't remember what is Fragile X syndrome. Dr. Savan, can you tell me what are the important points of Fragile X? Anyone? What are the important points of Fragile X syndrome? Yes. PG entrance question number one. Which is the most commonest cause? Which is the most commonest cause of mental retardation in children? Anyone? Which is the most commonest cause of mental retardation? And now mental retardation is obsolete. We say intellectual disability, which is the most commonest cause of intellectual disability in children. So you will, anyone? Okay, so anyone, you will say, sir, are you asking preventable cause or non-preventable cause? Yes or no? The most common cause, preventable, the most common preventable cause of mental retardation in children is congenital hypothyroidism. Yes or no? Yes, very good. The most commonest cause of preventable cause of intellectual disability is congenital hypothyroidism. And non-preventable, anyone? Non-preventable? Yes. The first most common non-preventable cause where I cannot reverse it of mental retardation or intellectual disability is Down syndrome. And second most commonest is neither, just right, nothing but Fragile X syndrome. Fragile X syndrome. Understanding? Yes or no? भाई समझ में आ रहा है ना? ठीक है. ओके. एंड फ्रेजाइल एक्स सिंड्रोम सर, और क्या मुझे पता होना चाहिए? बच्चे की नाक लंबी होगी, कान लंबे होंगे कि नहीं होंगे? यस. This picture, very beautiful picture, very beautiful picture. The baby will have large ears. The baby will have a large head. He's smiling. He's having some developmental delay or intellectual disability. है ना? Are you understanding? Yes. So remember photographic memory. Photographic memory. Look at the picture and tell. Can you see large ears? मेरे को तो नजर आ रहे हैं. Can you see a big head? Yes, I can see. If I show you these three pictures, what will you write and come? Anyone? If I show you these pictures, इस फोटो में क्या नजर आ रहा है? Very important point, bro. Can you see a high arch palate? High arch palate. ये दिख रहा है आपको? ये वाला arch, ये दिख रहा है palate? Yes, ये सावन दिख रहा है, bro. So ये वाला, this thing. So high arch palate. High arch, बहुत ऊपर है. High arch palate. Most importantly, the child has mental retardation. Is it a male child or a female child? So male child, male baby with developmental delay. Number one, mental retardation or developmental delay. It is a autosomal recessive inheritance. Very important. Developmental delay. So this baby will have delayed milestones? Undoubtedly, right? And the baby can have seizures. And most important also, there's a triple nucleotide repeat mutation defect. That already someone has told. Triple nucleotide repeat deletion or mutation defect. That's what. This part is over. This is micrognathia over. Now, which is the syndrome? Which is the syndrome where IQ is not affected? Which is the syndrome where IQ is not affected? What do you think? I think every one of us knows that. Even Oscar को भी पता है इस बारे में. We will answer it as Turner syndrome. Yes or no? In Turner syndrome, IQ will not be affected. Yes or no? Perfect. Turner कैसे एग्जाम में आएगा? A female with a webbed neck. Web. Can you see this web? Yes, a female with a webbed neck. A female with a webbed neck, you will think of Turner syndrome. And male with a webbed neck, you will think of male with a webbed neck, Noonan syndrome. Very good. Okay, that's it. Very answer. Okay, can anyone tell me 5 important points? I'm revising Turner and Noonan. Can anyone tell me 5 important points of Turner and Noonan? मुझे याद नहीं है. मुझे इतना ही पता है. A female with a webbed neck, then I will say Turner, and male with a webbed neck, I'll say Noonan. कोई और point, bro? Very good, very good, very good, हृदय. In Turner syndrome, the karyotype is 45XO, whereas Noonan, the karyotype is normal. बिल्कुल सही बात है. और कुछ? Yes. Turner, very good, Savan, very good. Turner is in females and Noonan is in male. I can say that. What else? Yes, very good, हृदय. मजा आ गया, बहुत अच्छा आंसर कर रहा है. The most common congenital heart, the most common congenital heart in Turner syndrome is bicuspid aortic valve, and most common cause of death in Turner syndrome is coarctation of aorta. And what is the X-ray finding of coarctation of aorta? Figure of three appearance. Figure of three appearance, or E sign, or reverse, what do you call it? Reverse three sign. Reverse three sign, E sign, figure of three appearance, right? Acha, or the most common congenital heart in Noonan syndrome is pulmonary stenosis. Yes, very good. किसने बोला ये? Shubhangi, very good. Turner syndrome IQ will be normal, whereas what you call it, Noonan syndrome IQ will be delayed. Very good. Any other point? I'll give you 5 more seconds. बहुत अच्छा आंसर कर रहे हो. कोई एक और पॉइंट गलती से, जूली, posterior hairline, okay, वो मिल सकता है. Noonan syndrome will have a triangular face, low set ears with posterior hairline. I agree with you. और कुछ जो बहुत छूट गया है, एक बहुत इंपॉर्टेंट पॉइंट. Anyone, I'll give you 5 exactly. Thank God. Julie has told a very good answer. What she has told is, can Turner syndrome babies can they have babies? The answer is no, they cannot have babies. Why? Because number one, they will have primary amenorrhea. Number one. Number two, they will have streaking of ovaries. Streaking of ovaries. And whereas Noonan syndrome baby can have babies. बहुत important point है, ठीक है? Yeah. So everything we have covered. Next question. Very good question. Very good. Anyone? What is this picture? What do you think? Anyone? What is this picture? What is this highlighter? ये एक ही picture है हर जगह, जो हर जगह घूमती है. Anyone? What do you call this exactly? Ganja, Savan, Shubhangi. So okay, yes, this is a case of, if I say the highlighter. अच्छा लगा देख के, क्या देखो. जूली से देखो मेरा नाम आया स्क्रीन पे, है ना? देखो, वेरी नाइस. वो गाना नहीं है, देखो देखो वो आ गया, देखो. यस, जूली, वेरी नाइस जूली, वेरी गुड, वेरी गुड. ठीक है, नेक्स्ट. दिस इज नथिंग बट catch-22. ओके, शुभांगी से डाउन सिंड्रोम. नहीं सिंड्रोम, नहीं नहीं सिंड्रोम कह रहा हूँ मैं. नहीं डियर, इट इज नॉट डाउन सिंड्रोम, इट इज catch-22. वेयर डू यू सी catch-22? द हिंट इज catch-22. Where do you see that? Have you heard of, very importantly, Dye-George syndrome? Yes or no? Dye-George syndrome, right? Dye-George syndrome. Anyone can even tell me fast, very fast. जल्दी बताओ. What are the points of Dye-George? Like this ऐसे आना चाहिए. जल्दी बताओ. हृदय, very good bro. Okay. T for thymic aplasia. Yes, जो आप बता, whatever you guys are saying, I'm writing. Okay, whatever you're saying. So, what do you think? Yeah, Neeraj says thymic aplasia. Yes. Have you heard of anyone? Atrial septal defect is very common in this one. What about the calcium levels? Yes, the baby will have hypocalcemia. And remember, this syndrome will have hypocalcemia. And where will you see hypercalcemia? ये question आया था exam में. A baby with high serum calcium levels. Anyone? Williams syndrome. Yes, Williams syndrome will have hypercalcemia, and Dye-George syndrome will have hypocalcemia. And normal Dye-George syndrome baby will have atrial septal defect. And which is the most common congenital heart in Williams syndrome? The most common congenital heart in Williams is supravalvular aortic stenosis. Supravalvular aortic stenosis. If the mother has taken dash during pregnancy, if the mother has taken dash drug during pregnancy, the baby will have supravalvular aortic stenosis. What do you think? हृदय को शायद आता है ये वाला. हृदय हमने डिस्कस किया था एक बार. हृदय, what do you think? If the mother has taken dash during pregnancy, the baby can have supravalvular aortic stenosis. Ganja, Julie, yes. William has elfin faces, I agree. If the mother has taken dash drug during pregnancy, the baby can have supravalvular aortic stenosis. What do you think, Hriday? Lithium, nahi. Lithium se kya tha? If the mother has taken lithium during pregnancy, the baby can have box-shaped heart. Box-shaped heart. And box-shaped heart is seen in Epstein anomaly. Anyone? Should I give you this homework or should I tell you the answer? हृदय, जल्दी बता. हमने करा हुआ है हृदय, साथ में करा था, तूने बताया था मुझे एक बार. डॉक्टर मनीष सोलंकी से एप्स्टीन, वो तो हो गया डियर. या इफ द मदर हैज टेकन लिथियम ड्यूरिंग प्रेगनेंसी, द बेबी कैन हैव एप्स्टीन अनोमली. ओके. nahi hriday says erythromycin. No, dear. If the mother has taken erythromycin during pregnancy, the baby can land up into congenital hypertrophic pyloric stenosis. CHPS होता है करके. ठीक है, very good. So this is the homework. If the mother has taken erythromycin during pregnancy, the baby can land up into congenital hypertrophic pyloric stenosis. So, this most common congenital heart in Williams syndrome is supravalvular aortic stenosis. If the mother has taken dash something, some drug, could be anything, not just drug, could be anything. If the question exam, if the mother has taken dash during pregnancy, baby can have supravalvular aortic stenosis. और तब मैंने बताया भी था कि remember guys, in Williams syndrome also the most common congenital heart is supravalvular aortic stenosis. So let's see. Give options. ऑप्शन दूंगा तुमको, तुम इधर आओ पहले. बाल कहाँ है तुम्हारे? वेयर इज योर हेयर? वेयर इज योर हेयर? गांजा विल से ऑलवेज अप्रिशिएट बार्बर. दैट्स ब्रो. सो पढ़ के आओ. ओके, दिस इज द होमवर्क डियर. ओके, सो यस. Catch 22, the patient will have cardiac abnormalities like atrial septal defect, abnormal faces, thymic aplasia, star mark. The thymus is absent here. Important question. Cleft lip, hypocalcemia. Again, star mark question. And 22, Q gene deletion. Star mark again question. 3 MCQs are there. Yes, exactly. Hint दो नहीं, मैं नहीं दे रहा. होमवर्क करके आओ. मुझे अगली क्लास में बता दूंगा. अगली क्लास में पक्का बता दूंगा. ठीक है. तो हो गया. So that's what difficult airway is seen in all the syndromes. ठीक है. Next question. What happens in Hurler? Can we revise some mucopolysaccharidosis? Can anyone tell me any rough idea of Hurler and Hunter? कैसे पता होगा हंटर कैसा होता है? हंटर, ओके. फिर गांजा says thalidomide. No, dear. If the mother has taken thalidomide during pregnancy, the baby can have what? The baby will have phocomelia. Phocomelia. What is phocomelia? Phocomelia is limb defects. Okay. So Hurler and Hunter. Anyone? In which one do you see clouding of cornea? In Hurler, you will see clouding of cornea, or in Hunter, you will see clouding of cornea. So in Hurler syndrome, yes, you will see clouding of the cornea, yes. And also in Hunter, what happens? See pictures also, remember, okay? Picture, photographic memory. What is this? This one is a Hurler syndrome, mucopolysaccharidosis, type 1. And then type 2, we have Hunter syndrome. What happens in Hunter? Remember, I'm going to a jungle with Hunter. I am going to a jungle for hunting with a hunter. As I'm going means I can see, right? So no clouding of cornea is there in the hunter, whereas there is clouding of cornea in the Hurler disease. Imagine I'm going to the jungle with a hunter. I'm a boy, X-linked inheritance, and I don't have clouding. Okay, I can see. So no clouding of cornea in hunter, and there is clouding of cornea in Hurler. Okay, that's what. Again, a motivating quote. Yes. यस, मोनी वाला सेज हंटर को हंट करने के लिए क्लियर आंखें. हाँ जी डियर, बिल्कुल सही कह रहे हो. अ वेरी ब्यूटीफुल मोटिवेटिंग कोट. इफ योर बॉडी इज नॉट राइट, the rest of your day will go all wrong. So take care of yourself. Very nice quote. Can we appreciate this quote? Your body is everything, right? You need to feed good things to your body. If you feed good vibes to your body will become good vibes. If you feed negativity or bad things in to your body, bad things will happen. If you eat bad stuff like momos and all, so bad, you'll become fat. If you go to gym and eat good juices and fruits and vegetables, your body will shine. Your body will like tomato gira and spark karegi, right? So if your body is not right, the rest of your day will go all wrong. So take care of yourself. Okay, take care of yourself. That's yeah. Hmm. Last question. Take a last question. Let's see if you can answer. An infant, now read the question by yourself. An infant with sparse, curly, hypopigmented hair, failure to thrive. There is seizures, frequent fracture. Very nice, very good point. Frequent fracture. Because whatever syndrome we are talking right now, battered baby syndrome. Battered baby syndrome is one of the differential diagnoses of this syndrome. And genetic analysis says positive. Genetic analysis shows positive for ATP7A. Very clear cut question. But again, examiner is very clever. PGI Chandigarh people are very clever. They wrote the line genetic analysis shows positive for ATP7A gene mutation. They're not asking what is the diagnosis. ATP7A gene mutation, everyone knows. ATP7A gene mutation is seen in Menkes disease, right? But they're not asking this. They're not interested in that. They're asking following are associated with this condition. So A, B, C, D, E, multiple options are correct. What do you think? हृदय बता दे भाई. सावन बोल. सावन अब अच्छे से पढ़ना शुरू कर दे, ठीक है? अब आ गया ना यहाँ पे, अच्छे से पढ़, ठीक है? अपने नोट्स वोट्स बना और मेरे वाला जिम ज्वाइन कर ले तू, बहुत अच्छा रहेगा। शाम को तेरे को अच्छे से मैं मारूंगा वहाँ पे और तेरे जिम भी अच्छा करवाऊंगा और अपने इंस्ट्रक्टर को बोलूंगा भाई ये मोटा है, बाहर की चीज़ बहुत खाता करके, वो तेरे को चार सुनाएगा और तेरे से डबल वर्कआउट करवाएगा। बाकी तुम्हारी मर्जी, तुम्हारी मर्जी, तुम्हारी जिंदगी है, मेरी नहीं, तुम्हारी जिंदगी है, तुम्हारी मर्जी। टेक्निकल कोर्ट के बाद एक्चुअली मैं बहुत वो खा रहा हूँ मैं, वो आया बफेलो मिल्क पी रहा हूँ बहुत। मलाई मेरे पापा इतना खिला रहे हैं मेरे को, रख रख के हाँ जी। द बेस्ट आंसर ब्रो, यस वेरी ट्रू। Do you see kinky hair in this condition? Yes. Do you see Trichorhexis nodosa? Trichorhexis nodosa, do you see that? Yes, very true. Let's move further. So the best answer for this one is you will see kinky hair. There will be hypotonia. All syndromes, usually all syndromes, Hurler syndrome, Hunter syndrome, Menkes disease, Wilson disease will have some like problem, like they will have mental or intellectual disability or developmental delay. Only Turner will be kind of normal, right? And of course, you will see Trichorhexis nodosa. You will see increase circulating ceruloplasmin. No, increase no. And anyhow, ceruloplasmin has no role here. Ceruloplasmin has a role in Wilson disease, and there is decrease serum ceruloplasmin levels in Wilson. Here in Menkes, there is no role of ceruloplasmin, right? So yes, A, B, C, E, Hanji, very true. Savan is very right. So Menkes disease, number one, the gene mutation is ATP7A gene mutation. Yeah, exactly. And I told you that in the liver and in the brain there will be high levels of copper, where yeah, in the yeah, copper levels in the brain and liver basically are low. There are low levels in the liver and low levels in the copper. However, remember, L for liver, L for low, L for liver, L for low, and brain also low levels of the copper levels basically, and they die before 3 years of life. These babies die before 3 years of life. And most importantly, the most common cause of death in Menkes is cardiac rupture. Cardiac rupture, which is the most common cause of death in, or which is the most common cardiac problem in neonatal lupus erythematosus. तो पढ़ा था भी शुरू में, neonatal lupus erythematosus. So complete heart block is common there. Okay, the patient will have a loss of previously attained milestones. Loss of previously attained milestones, and most importantly, it's common in boys. And vermian bones. Vermian bones are seen. And I told you, फाइब्रोब्लास्ट का प्रॉब्लम होता है इसमें, फाइब्रोब्लास्ट का, तो द पेशेंट विल हैव मल्टीपल फ्रैक्चर्स, एंड दैट्स व्हाई द मेंके डिजीज बिकम्स अ डिफरेंशियल डायग्नोसिस ऑफ battered baby syndrome. Battered baby syndrome, right? मेंके, किंकी हेयर, किंकी मिंकी बोलते थे हम, किंकी हेयर, ओके, किंकी हेयर, राइट? वेरी गुड, दैट्स इट। एंड दिस इज नथिंग बट ट्राइकोहरेक्सिस नोडोसा। वो क्या होता है? नथिंग, इन सिंपल वर्ड्स, हेयर के शाफ्ट में वीक हो जाता है। दिस इज माई हेयर, दिस इज द शाफ्ट, hair shaft becomes weak. That's all you should know. Known as trichorexis nodosa. And pili tortoi. What is pili tortoi? Nothing but again fragile hair. That's it. Very single word. It's a pathognomic sign. Which is the pathognomic sign of this one? Menkes disease, pili tortoi, that you should know, ठीक है? That you should know. Then what is this loose abdominal skin? हमने पढ़ा हुआ है, ये क्या बोलते हैं? This loose laxity of the abdominal walls, cutis laxa is nothing but skin hangs loosely. याद है कि नहीं याद है जूली? Remember? And here only the skin hangs loosely, nothing but cutis laxa. And also one, I asked you one syndrome. There was one syndrome also. There's a laxity of the abdominal wall muscles. Laxity of the abdominal wall muscles. Okay, what do you think? Which syndrome is that? याद है? अनुराग? अच्छा, अनुराग भी आया हुआ है, क्या बात है। तो यस, व्हाट डू यू थिंक हृदय? कोई और सिंड्रोम बोला था मैंने, एक मेरी जूनियर है आर निशाश्री, उसने वीडियो बनाया था इसमें एक अलग सिंड्रोम पे। हेलो एवरीवन, वेलकम टू पीडियाट्रिक्स बाय डॉक्टर आनंद। सो दिस बेबी हैज अ लैक्सिटी ऑफ द एब्डोमिनल वॉल मसल्स। कोई सिंड्रोम याद है सावन? क्या था वो सिंड्रोम? The answer is, कोई बताए तो मान जाऊं, prune belly syndrome. Have you heard of prune belly syndrome? जूली, डू यू रिमेंबर? ये सेम क्वेश्चन मैं पिछली क्लास में पूछ चुका हूँ और किसी ने जबान नहीं खोली है. प्रून बेली सिंड्रोम में एब्डोमिनल वॉल की मसल बिल्कुल लूज जाती हैं. लेटर प्लीज गूगल इट, प्रून बेली सिंड्रोम. यू विल नेवर फॉरगेट प्रून बेली सिंड्रोम. ओके, नेक्स्ट क्वेश्चन. That's it. That you should know. So that's what that finishes today's session. That finishes today's session. And thank you so much, everyone, for this wonderful participation. Let's talk for just 1 minute and let's wind up the session. Before leaving, the motivating quote of the night is, everything is temporary. Everything is temporary. This pain is temporary. The struggle you are facing is temporary. The hard work you're doing is just for some time. It is just temporary for some time, right? And so much of this craziness which you have, that I want to do something in life, it just let this exam get over. This all is temporary. Everything is temporary. Don't stress out. Relax. Control your heart rate. All India rank 7. All India rank 7. She told me that, sir, tell the students to control the heart rate. They should not lose themselves during the exam. Don't stress out. Don't struggle, right? The If you start panicking, you forget everything. Everything you forget, right? Exactly. That's true. So yes, Monibala, that's right. This part basically is nothing but it's temporary. Shubhangi says, sir, you won't be there in Delhi on 11th. No, dear, I'm there only in Delhi. We are going to some five-star hotel. We are planning to go tomorrow, maybe Leela or somewhere. And 11th ko I'll come back. We'll check out. And 11th evening, I'll spend time with my family, because family is must. Okay, you should never leave your parents. So family is must. So 11th evening, we are planning to have dinner with family. So I'll just going one day ऐसे ही घूम के आ जाते हैं ना. Can I go? Can I go or can I not go? Okay, thank you so much, everyone. Yes, yes. Anurag says, sir, I really feel this time I will do my best in FMG exam. Very good, Anurag. You were born to rock. You are rocking. You were born to rock. इनके भर का भी डाउट मत रखो कि तुम नहीं कर सकते. बस कर दो. बट मैं यही बोलूंगा कि यूज योर कॉमन सेंस ऑल्सो. हम बोलते हैं ना, कॉमन सेंस इज नॉट दैट कॉमन. कॉमन सेंस इज नॉट दैट कॉमन. So, see, everyone, this advice is for everyone. Once you go in the exam, don't go with a pre-planned thought that I have done all the MCQs and the same MCQs will come. That exact ditto same MCQ is not going to come. The concept should be clear. The topics should be done, right? Like hypothermia, neonatal sepsis, topic I have like, and are you understanding? Don't go with this thing that I have crammed 100 MCQs, 50 to will repeat, I will pass. So you will go mad because questions are different, options are reciprocated and shuffled up. So you go mad. Are you understanding? So don't go with this one कि मैं तो इतना पढ़ के गया था, I read 1,000 MCQs, the same MCQ didn't come. Oh my God, I'm so sad. No. Go with a concept in mind. Go with something that I have read all the amazing high yield topics and I think I will rock. No problem. And use your common sense. Choose the closest best option. Are you understanding? ये मत सोच के जाना कि रटा रटा आएगा. नहीं. Imagine you are the only doctor. तुम होते तो क्या करते? Think in that way. When the question is there and you don't remember the answer, or you know only half information about it, just use your common sense. That if you were there in this case, what you should have done. Do you want to continue phototherapy? Do you want to continue breastfeeding, like that? Okay, that you should know exactly. Yes. Thanks a lot, everyone. हृदय, क्या ये तुम हृदय से बोल रहे हो? हृदय कुछ कह रहा है. A man who don't spend time with family is not a real man. Godfather. Yes, bro. और obviously अच्छी बात है, अच्छी चीज़ बोली है हृदय ने. I'm proud of you. So a man who don't spend time with family is not a real. Exactly. Hmm. मोनीमला से, सर आप एक लिस्ट दे दीजिए इंपॉर्टेंट टॉपिक्स का. ठीक है डियर, आई विल मेक द लिस्ट. मुझे याद दिला देना. आई विल मेक द लिस्ट ऑफ इंपॉर्टेंट टॉपिक्स. आई विल शेयर इन द ग्रुप ऑल्सो. ठीक है. एंड टुमारो मॉर्निंग, अच्छा जाने से पहले बातें तो हो ही रही हैं. टुमारो मॉर्निंग वी हैव अ क्लास. टुमारो मॉर्निंग 9 AM we have a class on nephrology. Finally, I'm starting nephrology. So maybe I'll start something with the light topic of what is UTI, urinary tract infection, or maybe I'll touch up on nephrotic syndrome also. Very simple MBBS level, NEET PG level we will discuss tomorrow. Okay, tomorrow morning 9 AM last class, then 2 days we'll try to have. Thank you so much, everyone. Have a wonderful evening ahead and good night, sweet dreams. Take care and be happy. ये सब ठीक है, सब हो जाएगा. Tell yourself is well, सब अच्छा.